Live Edition, brought to us by our own Enoch Pratt Free Library under the leadership of CEO Heidi Daniel. On behalf of BCF, its constituencies, its stakeholders, we want to thank the Enoch Pratt and Ms. Daniel for their partnership, their leadership, and their service to Baltimore City residents and communities at all times. Hello, I am Shanesha Sauls, President and CEO of the Baltimore Community Foundation. We are so proud to host this timely Writers Live edition brought to us all by the Enoch Pratt Free Library under the leadership of CEO Heidi Daniel. We want to thank the Enoch Pratt and Ms. Daniel for their partnership, leadership, and service to Baltimore City residents and communities at all times, and especially during the pandemic. There's a lot going on in the world with new guidance coming by the day. And for us Baltimoreans, we receive new guidance today. So at a time such as this, when there is a lot of fear and uncertainty, and yet itching for normalcy, we really need the voices of reason and platforms for getting good information to make the best decisions possible for our health and safety and our loved ones more than ever. So there's another reason for us to be excited for this particularly timely Writers Live, as it features our own Dr. Leana Wen. And on this day, as we are at some sort of inflection point in the pandemic, we are fortunate to have Dr. Wen, who is a proud Baltimorean, but uses her platform in order to provide a voice of reason and science around the risk and prognosis of COVID-19. Yet at the same time, she is never too busy to attend a board meeting. She is never too busy to lend her insights, to field questions, or to review guidance. So we are thankful and blessed to have her here, and I am delighted to be able to co-host. Darcel?
Good evening. Thank you so much for being here, and thank you to our partners at the Baltimore Community Foundation. I also want to thank our media partner, WYPR. I'm Darcel Graham, Deputy Director of Public Services at the Enoch Pratt Free Library, and I'm so happy you're able to join us for this very special virtual event. Throughout the pandemic, the Pratt Library has been able to continue our popular Writers Live series virtually. We can't wait to welcome you all back when we're able to do our programs in person. The Pratt Library has been working throughout the past 18 months to continue to provide critical services to customers across Baltimore and Maryland. We reopened our doors to the public back in March, and I'm proud to announce on August 16th, we will be expanding our hours at all 22 Pratt locations. To celebrate, we have some special giveaways for our customers who stop by our locations on August 16th. We hope to see you. Now, for tonight's big event, Dr. Leana Wen has been named one of Times Magazine's 100 most influential people. She is an emergency physician, a CNN analyst, and Washington Post columnist. Many attending today's event remember Dr. Wen's time at the Baltimore City Health Commissioner. She has been a commanding voice in the fight against COVID-19. Her new book, Lifelines, A Doctor's Journey in the Fight for Public Health, is being called captivating, inspiring, and brave. You can purchase that book through our friends at the Ivy Bookshop. Tonight, Dr. Wen is in conversation with the host of Midday on WYPR, Tom Hall. It is my pleasure and honor to welcome Dr. Leana Wen and Tom Hall.
Thank you, Darcel, and thank you, Shanesha. Welcome, everybody. It's great to have you all here. And Dr. Leana Wen, welcome to you as well. And congratulations on this really, really great book. I'm glad it's being received as well as it's being received all over the country. Welcome.
Thank you very much, Tom. And can I also add my thanks to you for moderating this conversation. You've already been very kind to have me on your program, the outstanding program that I love and listen to all the time, Midday with Tom Hall on WYPR. And I'm also really thrilled to be coming together. I'm sorry that this is virtual, although I'm sitting here in my home in Baltimore, but I'm thrilled to be coming together with some of my favorite people in Baltimore, Shanesha and BCF. Thank you you, and of course the Enoch Pratt Free Library. Darcel, Heidi, all of you, you have done incredible work. I am so pleased to partner with you, to continue to partner with you, as you were an incredible partner when I was the health commissioner in Baltimore as well.
Well, it's great to have you here. And I want to jump in to talking about this really wonderful book right at the top, right at the beginning, because this book, for those of you who haven't had the pleasure of reading it yet, it's part memoir and part prescription for what public health should be, how it could be reimagined, and where we could take it. But the beginnings of your life were really quite incredible on so many levels. Talk about the reasons you and your family came to the United States. You were born in Shanghai, China in 1983, and right before your 8th birthday, you emigrated to the United States. Set the scene for us there. Why did you and why did your family decide to come here?
Well, Tom, I do want to first mention, if I may, that when I first started writing Lifelines, first of all, it was not called Lifelines. The initial title for the book, I'm not sure if my publisher will be very happy with my saying this because it ended up being the rejected title. But the initial title for the book was Public Health Saved Your Life Today. I had intended to write this book not about my own journey at all, actually. I wanted to tell the story of Baltimore. I wanted to show the world what I know, what you all know about the incredible innovations, the dedicated people working here in our city, and the difference that we're making. And I also wanted to demonstrate then about the projects that I was so proud of overseeing in Baltimore, our program Safe Streets to interrupt violence, our opioid overdose work that saved more than 3,000 lives in 3 years, our Be More for Healthy Babies program that's still going on strong now, that during the time I was here reduced infant mortality by 38% in a 7-year period. I mean, that's what I had initially intended to write the book on. But in talking to my publisher over time, I started to realize that my story is also a story of public health. And that story was hard to write because I think, like many people, I had blocked out some of the difficult parts of my childhood and even my adulthood, just things that I didn't really want to tell people and I had squirreled away and hidden away somewhere. I had not really talked to a lot of people about, Tom, the question that you're asking about immigration. I think people may have known parts of it, but maybe not everything. My parents and grandparents suffered a lot during the Cultural Revolution in China. They were dissidents who fought against the communist government. My grandfather, my father were imprisoned. My grandfather was an academic in China who was hauled out and beaten in front of his students. My father had a lot of political troubles, including the time that I was growing up, and I went through long periods of time without seeing him. And I say all of this because I knew from an early age that the plan, the goal, was to leave China. I didn't know when this was going to happen, but this was our goal. And really, the only way that you could leave China at the time was for people to come to pursue graduate education. So my mother, one day, was very happy. She got into a graduate program here in the US. Actually, she got into 2 graduate programs. One of them was in Chicago at the University of Illinois. The other one was in Logan, Utah at Utah State University. These are the days pre-Google. She asked her professor, "Where do you recommend that I go?" And the professor said, "Oh, Utah. That is where it's at," or something to that effect. But it was Utah that we ended up in. I mean, in the book and in general in life, there's so many crossroads, and it's kind of funny to think through where would we be if we had gone to Chicago instead of Utah. But that initial experience very much shaped me too. I mean, when we first came to the US, my family and I had $40. We didn't have money to buy blankets. We didn't have money for heating. And we came in December in Utah. It was very cold. And I mean, we did go through a number of hardships. I mean, my parents worked multiple jobs. My father delivered newspapers. He washed dishes in a restaurant. He was an engineer in China, but couldn't find work, and his degree wasn't recognized here, and he also didn't speak English. My mother, who did speak English, ended up studying to be a teacher. She taught second grade in Los Angeles. We ended up moving to LA for many years. But while she was getting her teaching degree, she was also working in a video store and cleaning hotel rooms. And we still went through many periods where every single day we were worried about two things. We worried about money, and we worried about our immigration status. And I remember that to this day, the arguments that my parents would have, the kind of the angst that we would go through, worrying about, are we going to make rent? We were actually evicted several times when I was a child, and we ended up experiencing homelessness. I mean, these are the things that definitely inform who I am and why I entered medicine and my understanding of public health, but are stories that I actually had not previously shared prior to Lifelines.
Yeah, and clearly it has informed your approach to public health, and I think it has absolutely engendered deep empathy and compassion on your part, because that is the other thing that comes through every page of this book, your understanding and empathy for your patients and for people at large in terms of your position as a public health official. Let's talk about your mother a little bit, because it's also a very poignant part of this book. She's no longer with us. She passed away from cancer in 2010. But your relationship with your mother, you write about in a very open and vulnerable way. First of all, it was quite extraordinary that she was in a graduate program. And so beginning with that, and then trace the sort of chronicle for us that as you grew up as clearly a very precocious and smart little girl, your relationship with her and how that evolved.
Yeah, I mean, this was another part of the book that I had not at all intended to write about. I mean, this was supposed to be a book about the work that we did in Baltimore. How did I end up writing about my mother? Well, motherhood ended up becoming a sub-theme in the book, and probably because I was thinking a lot as a mother now myself. I have two little kids. I think a lot of you in Baltimore know about this, that I have a son who's almost 4, named Eli, named after the late Congressman Elijah Cummings, who I miss dearly. And I have a 1-year-old, my own pandemic baby, who just turned 16 months old. And so, of course, I'm thinking about children the whole time. I actually finished the book prior to the pandemic when I was pregnant with Isabel. And so pregnancy, motherhood was very much on my mind. And I think being a mom too made me reflect so much about my relationship with my mother. And there were just memories and snippets and things that came back that I actually felt really ashamed about. And I'll explain. I had what can at best be classified as a strained relationship with my mother growing up. Looking back, I was resentful that my mother was never there. But here's why she wasn't there. And at the time, I'm sure I knew this, as intellectually someone told me, but I don't think I knew how to process this as a child. So my mother was in the 5th grade when, because of the Cultural Revolution, all the schools stopped. And she was not able to get formal education beyond the 5th grade. Her mother smuggled books in, and she read by candlelight at night in order to try to keep up her studies. At some point, the Cultural Revolution ended. My mother was in her mid-20s, and she was given one opportunity to apply for college. And again, she knew she wanted to come to the US. She wanted to have this different life. And she had to get into college, but having gone through no more than a 5th grade education, she took the test, she got into university, but the requirement was that these students all had to live on campus, even if they had children. And again, she was much older than everybody else was at the time, who were like 18. I think she was mid or late 20s at that time. She had to live on campus too. And so I didn't see her growing up because she was studying. And she was studying in order to get a better life for me later. But of course, I had no concept of that growing up. I just knew that I was raised with my grandparents. Everybody else saw their mother. I didn't. So I was resentful. Fast forward to, we moved to the US. I was taken away from my grandparents who raised me. And I never saw my mother still, because why? She was in a graduate program. She was working all the time. The only time that I saw her actually was, I remember this so clearly. She wanted to make sure I learned English because when I came here, I didn't know English. And she was very strict about here's how you need to learn. She said, you have to memorize 100 vocabulary words every night. And every night, she would make sure that she drilled me on the spelling, the use of the word, the definition, 100 words in addition to all my studies, which a lot of kids might resent that. But here's the thing. I was always asleep because my mother was working multiple jobs and studying. By the time she came home, I was asleep. So I remember being awakened every night to be drilled in these vocabulary words. And again, I mean, I was such a brat. Now I think back to this, I was such a brat. I said to my mother every night, why am I doing this? This is so terrible. Without thinking for a moment about how tired she must have been and the kind of sacrifice that she was making, that every night she was coming home to say, I want you to have your best life. This is why we're doing this. But in any case, I mean, we just never really became close. We fought a lot. And I didn't really get to know her until she was diagnosed with what turned out to be metastatic cancer. And I was her caregiver for 8 years while she fought her cancer, and went through many rounds of chemotherapy and radiation. And even in that period, we still fought and argued a lot. And now, I mean, my mother died, Tom, you mentioned, but she died in 2010, and well before I had my kids. Now with my kids, I think about my mother every day. I mean, I think about how much she would have loved them. I mean, she was a teacher. She really loved kids. She often talked about being a grandmother. And I wish that my kids were able to learn from her. And I hope that her legacy, that I'll be able to impart her legacy to them in some way.
And we learn in the book, by the way, that you came at age 8 or below, just before your 8th birthday, not speaking any English. And by age 10, just 2 years later, you were winning the spelling bees in your grammar school. So the 100 words stuck. You remembered the words, which is pretty impressive. When you look at your basic biography, there's a lot of things about it that show incredible accomplishment at a very early age. You went to college at age 13. You went to medical school at age 18. You hold 2 master's degrees as a Rhodes Scholar from Oxford. You've worked in Rwanda with HIV/AIDS patients. You've been in public health and on the national and international scene. And you're very humble about it when you recount this in the book. For example, when you talk about going to college at age 13, you say a lot of people think that because I was only 13, I went to college, as this meant I was really smart. It really had more to do with money. Explain how that could be the case.
Yeah, I mean, that's a part of my bio that I actually tried to not tell people because my age was something that for me was a point of shame for so many years. I didn't want people to know how old I was. And I'll explain. When I was a preteen, I mean, this is again around the time that I was 10, 11, 12, 13, I knew that, again, money was what my parents were worried about all the time. We struggled with it. We were very fortunate at some point to be granted political asylum. We were able to stay in the country because of that. But we struggled so much with money, actually, that my parents ended up sending back my little sister to China when my sister was born when I was 11 and a half. And I was so devastated. I mean, I actually had really wanted to give my sister the opportunities that I thought that I didn't have. And again, this is one of these things that I look back now and I think about the things I must have said to my mother at that time about, well, why is she gone? Don't you care? And my sister was sent back to China when she was 3 weeks old. With my kids, I cannot imagine being apart from them when they're 3 years old for that period of time, much less when they're 3 weeks old. And my sister was in China until she was 3.5. And so my parents didn't see her. I didn't see her for that length of time. And there wasn't FaceTime or Skype or something at the time. But I mention all of this because my parents had said, for financial reasons, we can't raise her here. And I thought, I really want to help with these financial reasons. I want my sister to come back. I don't want my parents to worry about me being a drain on their resources. There was a work-study program at California State in Los Angeles, close to where we lived in LA, that also had an early entrance program where you could test in to college. And I actually tried to channel my mother in that time. I thought if she can test into college, having no more than a fifth grade education and studying by candlelight and then working at a factory, surely that's something that I can do too. And so I tested in, I started working in a lab. And one of the things that I recount in the book, and this one, I was glad to tell the story. Not that the other ones, I mean, I wrote the book, so I was glad to tell the stories, but I really wanted to share this particular story because I think there are a lot of people who grow up in disadvantaged backgrounds who don't know the unwritten rules of the road. And I was one of those people. I knew that I wanted to apply and become a doctor, which, I just didn't know how you would get there. And it wasn't until I met, until one of my mentors, well, I was very fortunate to meet early on, Dr. Raymond Garcia. He and Dr. Donald Paulson, and another mentor, they introduced me to their previous students who had gotten into medical school, who were residents, and who shared with me, for example, that you had to take prep classes to improve your MCAT scores, that was worth the investment, that you need to get volunteer experience working clinically, that community service that I was already doing with my church and on campus could count towards community service for a medical school application. You should put that in there. I mean, these are things that I think people who come from backgrounds where a lot of people around them are doctors or went to medical school, it's just kind of intuitive, but I didn't know. And Dr. Garcia was also really instrumental because I went to this large commuter school where a lot of people wanted to go into medicine, but few people made it. And I remember my career counselor's office, when I told them that I wanted to go to medical school, basically said to me, you're not going to get in. There are plenty of people with your profile, your scores and everything else to apply. And they apply to 40 medical schools and they don't get into any. I told this to Dr. Garcia and he said, in that case, you need to apply to 41 medical schools. Which is what I did, and I got in. And again, I shared the story of going to college at that age because it wasn't really about the age that resulted in my not knowing about the unwritten rules of the road. It was because of my background. And it reminds me of the aphorism that talent is universal, but opportunity is not. And I think that is a lot of what the work of public health, public education, our library system, so much of the work that we do is about making that opportunity universal as well.
Yeah, and you were accepted to 13 different medical schools. You ended up going to St. Louis to Washington University Medical School, and then to the Harvard Medical School for a residency in Boston, and you were at George Washington after that. In addition to your age, which you've always been very sensitive to, as we learn in the book and you've just commented on, you say your greatest shame was your stutter. And this, I think, will be surprising to people because we're all so used to turning our televisions on or our radios on and hearing you talk so compellingly and so with such great erudition about COVID-19 in particular. So the world thinks of you as a public speaker on a certain level, yet speaking for you was somewhat traumatic. Talk a little bit about that.
Oh, very much so. When I was growing up in China, I knew that I stuttered. I mean, how could you not know that about yourself? But I also knew that I could hide it. I learned years later that this is called being a covert stutterer, meaning that there are some people with an overt stutter, as in there are long pauses, there are blocks, and you can hear it in them. There are others who are covert, who are able to know. For example, I never asked when I came to the US and understood English. I wouldn't have done this, obviously, but in the US, I knew that P was a problem. And so I didn't ask for a pencil, but something to write with. Or if I thought that I couldn't ask for a sandwich, I would ask for what's on your menu and then point to it or say the one with the turkey. I mean, there are so many different gymnastics that you could do as a covert stutterer, as I learned later. The only issue though is you can't always hide your stuttering. And you're always thinking about it. And so there was this one time I remember when I was in school, I think I was in 5th grade or something, and I was supposed to give a talk on the Roman Empire. How can you substitute that one if that literally is your topic? And so I remember that I was so desperate to get out of that talk, because that's the thing about being a covert stutterer. You fear people finding out about it so much that you would do anything to get out of it, that I stabbed myself with a pencil to try to get out of it so that I would end up going to the nurse's office. I mean, that is how desperate it was. And I also felt so alone because I didn't know anyone else who stuttered. So I thought, I didn't talk about this with anyone. And it was just this great source of shame that actually prevented me from making friends. I mean, part of why I didn't make friends early on was I was really young, and people were older, and that was one of the reasons. But another reason was I didn't know how to let people get to know me, because then they might hear me stutter. And for me, that fear of people finding out was so great that I didn't want to even risk having friends in the first place. And so it actually wasn't until I was in medical school. I was more than halfway through medical school, and there were multiple experiences where I thought that, oh my goodness, I'm going to get found out. I was on a neurology rotation, stumbling on the word neurology. I mean, how do you replace that when you say to somebody, hi, I'm the medical student on the neurology service? Well, how do you replace that one? But it wasn't until I was in medical school that I finally sought help. And I remember going for the first time to see this woman who turned out to be my speech therapist. And she invited me to attend a group meeting of other people who stuttered, which was very smart of her. Her name is Vivian Siskin. She works at the University of Maryland. I think she knew that if she just told me the key to your recovery is recognizing that you're a person who stutters, I would have run in the opposite direction. I would have said, I can't do that. And so she said, you know what, come and meet some other people. And I came to this meeting and met a NASA astronaut, lawyers, professors, people who worked at the World Bank, people who were actors. I mean, they came from all walks of life and were all ages. And in that group were many others who were also covert stutterers. And I began over time to accept this as my identity, that just as I'm an Asian American, I'm a woman, I'm a doctor, that I'm also a person who stutters. And only in recognizing that did I start actually unpacking my speech, as in, it took years actually for me to say what I want to say when I want to say it. As in, instead of saying, oh, I can't say this word, so let me find all these other ways around it. It took me years to figure out that actually what success looks like is not having these mental gymnastics and not being afraid of who I am and what I'm saying. And I'll just give you one more example of this, that when I finally figured this out and said, oh, wow, I can say what I want to say, something else happened, which was that I realized that I had all this mental space, because before I was always planning 2 sentences ahead. And now I have all this additional mental capacity. So anyway, I shared the story of stuttering, and actually one of the first times that I talked about this openly was at a Stoop story here in Baltimore. I share this because not everybody has a story of their stuttering and their speech, but I think a lot of people can relate to something that is a deep source of shame, that is a core part of our identity, that for whatever reason we haven't wanted other people to see, that prevented us in some way from achieving certain goals or doing certain things that we otherwise would have wanted to. And I share that because for me, that was stuttering. But what was holding me back wasn't the actual stutter. It was the fear and shame over my identity.
And you may have spent a lot of time avoiding certain words at certain periods of your time, but one of the things you didn't avoid were the big problems facing Baltimore when you became the health commissioner in 2014. You addressed them head on and with great imagination. Let's talk a little bit about your years in that role. This is a job you loved. You called it your dream job. Talk about what you found when you got here to become the health commissioner. and how you approached your mandate and mission at that time.
Yeah, I mean, I was so glad and so proud to share the experience of being the city's doctor, of being the health commissioner here in Baltimore. It was my dream job, as I mentioned, because I came from the ER. I mean, I had so many experiences working in the ER that were really, really frustrating. I mean, they were experiences where I wanted to do what was best for my patients, but I knew that what I could do for them wasn't best resolved from the walls of the hospital, as in, what was I supposed to do for this patient who has hypertension, diabetes, and heart disease? And I'm advising them to eat healthier foods, but they tell me that they live in a food desert where they have to take 2 buses and then walk 10 blocks, and then it's a Whole Foods and they can't afford that food. I mean, what am I really doing for them? Or I talk in Lifelines about this boy who I saw a lot with asthma, who came in all the time for asthma attacks, but the problem wasn't that he needed a new inhaler. The problem was that he and his mother were experiencing homelessness. They were in shelters where people smoked. They were across the street from an incinerator that was spewing out stuff that was triggering his asthma. And they were living at some point next to vacant buildings that were full of mold. And you just feel really hopeless as a clinician in that setting, because you feel like you're not doing what's best for your patients. You know what your patients need, but you're not able to provide it for them. And I thought, coming to work in Baltimore, this was the opportunity to address these social determinants of health, these other issues that matter so much in our patients' lives. And that was the opportunity. I was very fortunate to be appointed the health commissioner back in 2014 by then Mayor Stephanie Rawlings-Blake. She had a saying that I really believe in, which is, if everything is a priority, nothing is a priority. And so coming in, I knew that I needed to focus on some areas which everybody's going to disagree. Somebody else, another health commissioner, would have focused on different topics. Are there things that I wish I did more about? Absolutely. I wish I did more on homelessness. I wish I did more on lead poisoning. I mean, there's so many issues that I wish I did more on. But you have to start somewhere. You can't let perfect be the enemy of the good. And I think sometimes in public health, there is a tendency to decision paralysis, because if everything's affected by everything, where do you even begin? Well, we said, here are the 3 issues. We are going to focus on the opioid epidemic, because addiction ties into every aspect of our city. We're going to focus on care for the most vulnerable, because that's about health equity. And then we're also going to focus on our children. We're going to focus on youth health and wellness, and on children's health, because as Congressman Cummings often said, our children are messengers to a future that we will never see. I don't think any of us would want to leave the future to be one that is worse than the one that we have. We don't want our kids to have a future that's worse than we have. And so we need to work on focusing on them. So that's how we initially approached the work, and also specifically said, we're going to work in partnership. This is not the health department working in isolation. We might lead these efforts. We might lead citywide initiatives, but we want to work in partnership. And so I was so proud of the fact that Be More for Healthy Babies, as an example, is a citywide collaborative, more than 150 partners. Our opioid work also was across our hospitals. We engaged all of our hospitals, community partners, and BCF was one of our major partners, in fact. And the Enoch Free Library was another one where we partnered with the library on many initiatives, including on getting naloxone, Narcan trainings in our schools. We were able to partner with the library on food access, and on as a way to reduce food deserts by having food be delivered to our libraries. I mean, really is quite. I think being able to highlight these successful partnerships, the work that we did, was definitely one of the best parts of writing Lifelines.
How do you think we can come to a place that you imagine in this book, where people understand the fundamental importance and the, I call it the centrality of public health? You make the point over and over, and in very compelling ways through the book, with lots of examples, that everything is related to public health. If there's a problem with transportation, that's a public health issue. If there's a problem with, as you say, these food deserts, that's a public health issue. Voting can be a public health issue. The problems with the post office are a public health issue. I mean, public health impacts and informs every single aspect of our life. You said at one point, you realize that so often your patients didn't need healthcare, they needed public health. How do you think we come to that point? How will we eventually get to the point where that is, an opinion, an understanding that is widely shared? And what would the world look like if more things were seen through the prism of public health?
It's such a great question. And I so appreciate it also because the initial title for the book, as we talked about, Public Health Saved Your Life Today, You Just Don't Know It, is based on the idea and the deep frustration that I felt actually working in the health department, that we saw the work that we do as life-saving and life-changing. We understood why it was so important. We could see the impact that it was having. But every time come budget time, the health department budget was first on the chopping block. And that's because the work that we do is about prevention. There is no face of something that you can't see. I mean, you can see the face of a child who has lead poison, but what about the face of a child who could have gotten lead poisoning if not for the lead remediation that you did in their home? You could see the person who was shot and killed tragically, but what about the person who was the beneficiary of Safe Streets, community violence interruption, and they never experienced that violence in the first place? I mean, or they were never put in that situation in the first place. I mean, it was just extremely frustrating that all these incredibly important programs, even our Healthy Babies program, lost funding. And we were able to piece together funding at the last minute, thanks to our federal partners and thanks to many of our amazing foundations here in Baltimore. That shouldn't have to happen. And I think one of the issues is, at least prior to COVID, whenever people talked about, whenever you saw politicians or whoever running for office, what would they campaign on? It was never on public health. They would campaign on public safety, education, the economy, all important issues, no doubt, and issues that I also care about. But I started realizing that we can't just be frustrated that other people don't care about our issue. We have to get them to care by talking about why public health is connected to what they care about. That if you really care about public safety, you need to start with a prism of public health, and recognize that throwing people in jail because they have the disease of addiction, because they have mental health issues, that's obviously not good for anyone. That's not helping public safety either. And it's not the humane thing to do. We should be treating addiction as a disease. If you don't have a healthy workforce, if we can't take care of our children's basic needs, if they're hungry, how are they going to be able to learn? I mean, these are all actually health issues. And by addressing public health, we're able to address these other issues that they care deeply about too. And so I think that's part of my evolution, if you will, in this role in Baltimore, recognizing that it is about meeting people where they are. In fact, that is a core tenet in public health, that you have to meet people where they are with what they care about. And I hope that going forward, that health officials across the country will also learn this important lesson as well, because we cannot expect other people to care. We have to get them to care in the words and the understanding that they have.
And boy, that gets tricky these days, doesn't it? When you have a certain part of the population here in the US refusing to be vaccinated, for example. These conversations with people who don't want to be vaccinated against COVID-19, meeting them where they are and having a conversation with them that can end up with their being convinced that there's a better way forward. These conversations are tricky. How do you think, generally speaking, the policymakers, the government officials, the public health officials are doing making that argument right now?
Yeah, I think it's really tricky. I mean, I think that I think we need to recognize that there is a message and a messenger. That often the messenger is even more important than the message. That's why the trusted messenger, if I were to walk the streets of West Baltimore and tell people, please don't participate in gang-related activities, please put down your guns, I mean, I'd be laughed at, right? Like I am not a trusted messenger in this sense. That's why Safe Streets, having individuals who come from the communities that they are from, is so effective in conveying that message. It's not just the message, it's also the individual involved. And I think by the same token, when we're talking about vaccine hesitancy and reluctance, we also have to recognize that that there are individuals who are reluctant because of misinformation. There are people who have distrust of the medical system. There are people who have heard all these conflicting messages and are confused and scared. And in times of crises, when you're scared, you often listen to a worldview that may not be right, but is one that may affirm where you're coming from. And so I think approaching people with compassion, not judgment, talking about facts, but then also recognizing when somebody else may actually be the most credible messenger to them, but then by the same token, recognizing that there is someone out there to whom we are the most credible messenger. And so what is our individual role going to be in helping to spread that message? I think that's also really important too, because there may be a cousin, a neighbor, a friend, a colleague who has not been vaccinated, who may even be actively spreading misinformation. But let's approach that person. It's not changing the world, it's not changing policy, but one thing that I emphasize over and over again in the book is you got to start somewhere. And there is something that each of us can do right now.
And listeners and viewers, we do invite your questions for Dr. Wen. Again, the book is called Lifelines, A Doctor's Journey in the Fight for Public Health. We have a listener question here, Dr. Wen. You share so many tough stories in your book, yet you have so much hope. So many of us have experienced trauma this year as well. How do you protect your mental health? And this is something you do write about in the book, in fact.
Yeah, I mean, it's such a really important question. And I have to just start out and say that we as a country do not value mental health the same way that we value physical health, when in fact they are integrally involved with one another. But you know, I do and did a lot of work with addiction, and I remember meeting someone whose son died from addiction when he was in his late teens, and she said to me, she said, "Addiction is not a casserole disease." And I really did not understand this. I thought, what is a casserole disease? And her point was that if her son had died from cancer or heart disease and people found out, everybody would bring casseroles. But at that time, because her son died from addiction and there was stigma associated with addiction and mental health issues, that people did not bring her casseroles. And she felt really alone. And we just see addiction differently and mental health issues differently. And even think about this at work. If somebody says, I just got diagnosed with diabetes, people would say, oh, what can I do? What do you need? What if somebody said, I got diagnosed with depression? Would people still give them that same level of compassion? And so I think part of it is our understanding of mental health, that we have to change our own ingrained stigma. And here, I think this is what you're alluding to, Tom, which is that I talk about in Lifelines about how I had postpartum depression after Eli's birth. And I did not recognize it. I mean, for all the help that I was helping to provide and the programs that I was running that provided postpartum supports and mental health help, and for all the work that I was doing to try to reduce stigma in mental health, I didn't recognize that I had a problem. And then when I did recognize my own issue and that I needed help, I was afraid to seek it. And then I felt embarrassed. I mean, I remember going to see the psychiatrist that my primary care doctor recommended. And she was a local doctor in a busy building. And I thought, oh my goodness, what if people recognize me? What will I say? And then I felt ashamed for thinking this because I'm trying to break down stigma. Why am I stigmatizing myself? But, you know, I think this is the degree of stigma that's out there about mental health. And so I think part of it is recognizing the issue, recognizing our own ingrained stigma that we may have ourselves, coming to terms with that, and then also focusing on well-being. We focus on physical well-being. I think we talk about this a lot, right? People talk about nutrition and exercise and sleep. But what about our mental well-being? What will help to center us? I mean, for me, I know that being with my kids is certainly something that helps to center me, although also having time without the kids, just a little bit of time every day, it also is important too, because otherwise, I think for so many of us working parents, you end up being work to kids to sleep, and that's not really great for physical health or mental health. And so for me, exercise is a form of mental health break as well. But I think being aware of your own needs is really important too.
And we have some other audience questions and I want to get to them. But before I do that, speaking of your kids, let's talk about how being a mother and becoming a parent, you and your husband, Sebastian, how has that changed your outlook on life in general and on public health in particular?
Well, motherhood changed everything, I think, is how I wrote this in Lifelines in a way that I had not really anticipated. And I mean, I think I had a lot of friends who said that to me before, and I just thought, oh, they drink the Kool-Aid. So, I mean, I'll first say that my husband and I also struggled with infertility, which was something that I wrote about in Lifelines as well. Something else that I think is often stigmatized and not discussed. And I wanted to share that story for a reason. So we were really happy when I got pregnant with Eli, and talked about the issues that I then had with postpartum depression. But once I think came to terms with kind of the difficulty of parenthood as well, and even the initial waking up all the time and feeding the baby all the time. And I didn't realize that this sleep cycle, I thought, oh, well, babies sleep a lot. Well, I didn't quite realize that they also wake up a lot and eat a lot. And I was struggling with breastfeeding and I mean, all these things. By the time we got out of the immediate period of caring for the kids' needs all the time, I really began seeing things differently. I mean, one of the hardest parts of my job in Baltimore was running the child fatality review, where, and I talk about this in Lifelines too, where we review every case of children who died in Baltimore. And there's a monthly meeting where everybody, all the heads of agencies are around the table. So you have somebody representing schools and police departments, social services, housing, et cetera, around the table talking about basically what happened in this child's life, whether it was a child who was involved in, or who a teen who was shot, or a baby who died from sleep-related infant death, or a toddler who died from abuse and neglect. I mean, these are horrible stories, and this was one of the most difficult parts of my job, was to preside over this monthly meeting, because these were all kids who, for the most part, had multiple points of intervention, and they were not caught, and then they ended up dying. I mean, that is so tragic and so awful as it is. But on top of that, in these particular cases, especially once I became a mom, I thought about every child as if I could have been their mom, and what must their parents have been going through. I mean, I had already, of course, had huge empathy and compassion for these families, but it was just a different way of processing everything that I did. It definitely gave new urgency to the work that we did around paid family leave and other legislative policies. Towards the end of my tenure in Baltimore, we also had several new members of the city council who were also parents of young kids, and we got common sense things done, like putting diaper changing tables in city buildings. I mean, things that, again, parents would think about, but maybe if you didn't have these young kids, you might not have that experience. And so I talked a lot about how being a mom also changed my perspective as a manager, that there were times when I scheduled meetings, for example, early in the morning or later in the afternoon, without thinking about how that would then lead the other people on our team who had to pick up their kids on this mad scramble. I mean, things that I just really was not aware of. I wish I were. And if I were to do things over, I definitely would have done a lot of things differently. But I think that's certainly an example of how we need people who represent all walks of life. And certainly moms and dads, parents, caregivers are that type of walk of life in a lot of different positions, whether it's in policy or as managers and leaders.
Here's another question from our audience. You've accomplished an incredible amount already in your career. You write a bit in the book about women taking the chance to apply for jobs that they may not feel qualified for. What advice would you give someone looking to make career shifts or to be confident in their skills?
It's a great question. I would say that you are already an incredible professional. I mean, I don't know exactly the background of the person who's asking this question, but I think there are a lot of us, depending on our background and who we are, that we may feel this imposter syndrome. And I actually wrote a lot about this in Lifelines, about the many times when I felt the imposter syndrome, wondering, why am I here? What do I really belong? Look at all these other people with their accomplishments. And I would just say, first of all, remember that there's always someone out there looking up to you. And no matter where you are in your career, maybe a younger sibling, it may be another student in your college, there's somebody else who's looking up to you and thinking, wow, how can I be like you one day? So be confident of who you are, what you've done. And then I would say, don't wait. I mean, one of the takeaways in Lifelines, but also one of my pet peeves often is what happens when you have all these when there are so many things that you want to do and so many things that you're passionate about, and I really want you to pursue your passion. One of the things that Elijah Cummings used to say was pain, passion, purpose. Channel your pain into your passion. That is your purpose, and you should do that. But remember that there's a way to make a difference right now. I often had young people, interns and others, come and say, my goal is to work on HIV/AIDS in Rwanda. That's what I want to do. That's great. But what about working on HIV/AIDS in Baltimore? What about working for an organization here that's providing food and home and shelter for individuals experiencing homelessness? I mean, there are vulnerable people who need our help right here in our communities. That's not to say, if you want to do global health work, that's fantastic, but don't wait until you have that opportunity. And I think going back to this question about confidence, building your confidence in your skills also involves having the experience. So getting the skills early on is really essential.
Another question from Facebook. What would you say is the role of dental hygienists in public health? This is something that Congressman Cummings talked a lot about too. He was very concerned with the state of dental hygiene for many of our citizens.
Oh, absolutely. I mean, that's another issue that we do not see as being connected to physical health. I mean, dental health should be just as important as any other aspect of our healthcare, but we don't have dental health insurance the same way. We don't have dental health access the same way, which is something that I actually also talked about in Lifelines. I added this in at a later part, because I had, as an adult, I had serious fear of dentistry. And I actually didn't really know why. I mean, I thought, a lot of adults fear going to the dentist, but why do I have this fear? Well, as it turns out, because I had all these memories that came out while writing this book, I realized why. Because when my parents and I first came to this country, we couldn't afford money for dentistry. We didn't have insurance. We didn't know where to go. And I was on, because I had bad asthma as a child, I was on steroids, and I had a lot of cavities and dental issues. The only way we could afford dental care to take care of my cavities was there was a dentist from China who was operating on the black market. He wasn't really licensed here. He was operating in his kitchen. He had a lot of supplies, but he didn't have anesthetics. And so I had all these cavities. I had a root canal done without anesthesia. I think that might explain why I have trauma that I blocked out about dental care. But I mentioned this in the response to this question because there are so many people in this position. And we really need to, the question about dental hygienists and public health, dental care is absolutely a part of healthcare. We need to change policies around it, but I think we also need to very integrally see the importance of dental care when it comes to physical health too.
This next question, again from the audience, what's next? What do you have next in your life, in the works? You've got another book perhaps, or another major step in your future that you are excited about?
Well, I cannot imagine writing another book right now.
I bet. This is your second, by the way, we should say.
Well, the story of this book, though, was that it was written and delivered to my publisher prior to the pandemic. And then my thought was, I'm going to deliver this book, I'm going to deliver my baby, and then at some point the book will come out, and then we'll all be happy. Of course,
Good
I had
plan.
the book out, but then we had the pandemic, and so I had to substantially revise the book, and I really cannot fathom writing another book. All this is to say, no, I'm actually really thrilled with the work that I'm doing now. One of my other mentors and a member of the BCF board is Senator Barbara Mikulski, who likes to say that you should do what you're best at and what you're needed for. So since COVID, I pivoted all my work to addressing the pandemic. That's why I'm doing research. That's why I'm doing my teaching. I'm doing public commentary and writing and working with policymakers. I mean, it's all around COVID. At some point, I do want to go to the next step, which is how can we reimagine the future of public health? Infection control, preventing the next pandemic, yes, that is a part of it. But I also really critically want to focus on reimagining the future of public health and really thinking through how can we make sure that people understand public health is not just about infection control. All these other issues that are neglected because of COVID, like the opioid epidemic, have been forgotten. But they didn't go away. In fact, if anything, they've gotten worse. So how can we lay the groundwork for making sure that people really understand the life-saving, life-changing impact of public health?
We just have a few minutes left here, but so much of what you're talking about, changing and reimagining public health, will depend on training that young doctors are getting now. What was your experience in medical school, and as it relates to what we should be teaching in medical school now? What advice do you have for young doctors and for young people pursuing medicine and public health moving forward?
Well, one thing is I hope that everyone who is pursuing a career in medicine or any type of healthcare field gets training in public health. You know, I used to interview medical students or people who wanted to be medical students. And one thing was always striking. They actually all, as pre-meds, they all actually understood public health. As in, they understood that the conditions in people's lives, the social determinants of health, very much impacted their health. So they got it. But that understanding of public health isn't necessarily fostered during their medical training. And so I think it is really important for us to, just as all medical students have rotations in pediatrics and neurology and psychiatry, why not also have a rotation in public health? And I would actually even go beyond that. I know we're coming to the end of our time, so I'll end with this, that I think it's really important for all of us to see ourselves as being on the front lines of the public health workforce. That if it's anything that we've learned during COVID, it's that we're all in this together, that you can't rely on the front lines being the hospital when the prevention work is done in the community. And I hope that that is something that we end up seeing as an end result here as well, that public health did in fact save your life today. Now we know it, but we also know that it's because of the work of all of us that we're able to advance this field, protect our health and well-being, while also critically reducing disparities and striving for health equity as well.
Dr. Leana Wen, thank you so much. It's always a great pleasure speaking with you. We appreciate the book. We appreciate your time tonight. Thanks to everybody who has tuned in. We are grateful to you for that as well. Let's turn it back now to Tracy.
Yes, thank you so much, Dr. Wen and Tom, for taking the time to be with us today. Make sure to get your copy of Lifelines from the Ivy Bookshop, our bookstore partner. Thank you to our excellent partners at the Baltimore Community Foundation and WYPR. Thank you to the Hearing and Speech Agency for helping us provide accessibility. And of course, thank you all in the audience for joining us tonight for this important conversation. We hope you'll fill out the survey we posted a few minutes ago. And we just want to say from the Pratt Library, take care and stay safe.